Thank you for joining us for our webinar to look at how SHINE can support emotional wellbeing with our young people in schools. My name's Michelle Matthews and I'm one of the SEIC QIOs. I'm attached to Scottish Borders Council, but today we've got representation from all of the authorities within SEIC, which is really good. And SEIC can see the value of SHINE and how it can support our schools with improving a well-being, emotional well-being for our young people. And I am based in Scottish Borders. We've got all of our schools have signed up to be members of SHINE. So there'll be some of you here today that already signed up that maybe know a little bit about SHINE, but there's also other people here that have maybe come along just to find out a bit more and see how it can support them. So I'm joined today with Demi, who's our data analyst from SEIC, and in a minute she's going to give you some housekeeping issues, go over a few things there. And we also have Dawn and Judith from SHINE who are going to present to us after Demi's spoken to you. So I don't think I need to say anything else. I'll just pass over to Demi.
Hi everyone, thank you so much for joining us this evening. We hope that you enjoy this webinar this evening as well. So just some housekeeping. If you'd like to raise any questions, please use the raise hand function, or if you'd like to type it in the Q&A box, I'll be monitoring the questions and I'll answer as we go. We can't see you and we can't hear you, but we can unmute you if you raise your hand. And I'm going to pass you on to Dawn and Judith, who are the SHINE managers, and I hope you have an enjoyable webinar. So thanks.
Okay, thanks very much. Judith and I are delighted to be here today. So we'll maybe just introduce ourselves first of all, and then we'll share some slides with you, and we'll be very happy to answer some questions later. So my name's Dawn.Haughton. I'm the SHINE network manager. So I work mainly with the schools and liaise with the schools. My background is in education, so 25 years I was a teacher and then a deputy head. So that's my background. I'll hand you over to Judith.
Hi everyone, I'm Judith Brown. I'm a research fellow and I've worked at the University of Glasgow for nearly 25 years now. So I've got lots of research experience and lots of different projects, but I joined the SHINE team just over 2 years ago. And yeah, really looking forward to telling you a bit more about SHINE. Thanks.
Okay. So what we're going to do with today's presentation, I'll just share some slides with you, is really explain who we are and what SHINE does, and then sorry, I'm just doing two things at the same time. Hopefully you can now see the slides. Have they come up? Yeah, okay, great. So as we said, SHINE is actually short for the Schools Health and Wellbeing Improvement Research Network, but you'll be glad that we'll just refer to SHINE throughout the presentation. So we're funded by the Mental Health Data Pathfinder Award, which was awarded to Professor Daniel Smith at Glasgow University. And we're actually based in the Social and Public Health Sciences unit within the Institute of Health and Wellbeing at the University of Glasgow. So basically SHINE aims to support schools to use health and wellbeing data to support pupil well-being. And as we take you through our presentation today, we'll show you how we do that. This is the team. There's a lot of us in the team, and we're spread across the Universities of Glasgow and St Andrews. So within that team we have many different disciplines, from social science to psychiatry to expertise in child behaviours, child and adolescent behaviours, and obviously essentially a research team. And I'm the only ex-teacher in the team, so that's my role. So where are we so far? Well, SHINE is a national network And we have schools in each of the 32 local authorities, and at the moment we have 213 SHINE schools spread across Scotland, and that represents over 111,000 young people. Looking at SEIC as a region, we have 60 primary schools, 6 all-through schools, 2 special schools, and 19 secondary schools across the 5 local authorities. And as Michelle said earlier, the borders have joined with all schools, so we have a fully SHINE local authority, so that's great. And how we started then in looking at how to support schools with the use of health and wellbeing data was we shared some data from the Health Behaviours in School-Aged Children survey, which that data was collected in 2018. And what we were looking to do with that data was to ask schools whether they would like to receive a school level report. This is a survey that's been going for 30 years. So every 4 years data is collected on the health behaviours of children aged 11, 13 and 15. And if you have a look at the slide, you can see that the kind of topics of questions cover all sorts of health behaviours, from diet and physical activity to mental health to general health, but also looking at relationships and support. So all these risk factors and protective factors which influence young people's health as they develop. So as I say, this survey's been going for 30 years. So all the data from that survey has always just gone into a national report. So our research has really been to look at what happens when you give the schools that data back and you make it accessible, and you look at what the school then needs to know about the data, how it's going to work with that data, and how we can support the schools to use it effectively. So those are the things that we wanted to find out. So we started SHINE 2 years ago by writing to all the schools who had actually submitted data in the HBSC survey. And we just invited them to have a school level report. But as soon as we started going out to conferences, loads of schools that weren't HBSC and hadn't given any data also wanted to get involved. And we were very keen to make our network as inclusive as possible. So for the schools that hadn't submitted data at that point and wouldn't get a school level report, we gave them a regional report. So they would have one from the South East Collaborative or the Northern Alliance, so that at least they had some recent data from their local context. And we're very keen, obviously, to embed practice within Scotland of Scottish schools being able to work with recent data from Scottish young people, rather than looking for facts about health behaviours from anywhere else in the world, so that it was local. So while we were deciding how to present the data, we obviously have the data presented in tables, which I'll show you in a moment. But we really wanted to make sure that schools had something that they could have a look at the context of the research that's already been done in the various areas. So the slide that you're looking at now shows the reports, the initial reports that we made with the section on mental health and wellbeing. And in there, it talks about the kind of factors that influence mental health and wellbeing for young people. We also provided a resource directory at the end of each chapter that was relevant to either mental health or diet and exercise or bullying and discrimination, so that we could provide schools with a list of organisations that would provide either free resources or training for teachers, but were trusted national sources that could show the schools, provide some ideas for who can help. But one of the main ethos, elements of the SHINE ethos is really to promote a whole school approach. So with the data reports, obviously schools work with a lot of data, with attendance data and academic data, and lots of data tables coming in. But we wanted our data to be in a format that would give you the sort of the so what, the what next factor. So in the whole school approach section, we suggested some ideas of how the various areas of the school can get involved, so that this isn't a report that just sits on the desk of the head teacher, but is a report that can be shared with the senior leadership team, with the staff, with the pupils, and then with the wider school community and the parent body as well. So we suggested through the whole school approach just some simple things that schools could think about, which may help within those different health areas. So this is how the data was presented, and you'll be able to see, so these were just 2 measures of pupils feeling left out, and then the WEMWEBS scale, which looks at well-being. And with the data that we presented, we split it by gender, so that you could see how the boys were getting on in relation, and we're able to compare that with the girls, and then the overall for both. And you'll see the faint lines behind, that was from the region. So we benchmarked the school level data against the regional data so that they could see how they compared with that. And the main reason for that was because the national data wasn't out yet. But the national report is also there, so you can also benchmark against the national figures as well. So, as I said, we were interested in how, oh, and Judith, I don't know whether you can see, Judith is just showing the national report there as well. But we can make that available after this presentation for you to have a look at. So, obviously, we are a research project which has a very diverse team, and we are really keen that we collaborate with all the key people that are working with education. So not just the schools, but the local authorities and the regional improvement collaboratives, but we also have very good links with Health Scotland, Education Scotland and Scottish Government. So the aim of SHINE really as a network is to bring together schools with health researchers and with policymakers, so that we are able to look at health and wellbeing data and work together with it. So when we have Judith just now, who's going to talk about the wider work of SHINE and how we share practice in our health and wellbeing community. In just a moment, sorry.
No, I'll talk to this one, Dawn, if you want me to.
Okay, yeah, that's fine.
Yeah. Yeah, so you've probably all been sent, you know, our website. There's lots and lots of information on our website, and there's all those reports that Dawn was talking about. There's an example report there for you to see on the website. I don't know at this point, Dawn, do you normally mention that when schools sign up to SHINE that they get their individual folder with all the documents in that?
Yes, yep. Mm-hmm.
But we also run this series of webinars. We've had I think we've had 3 webinars. We have them again about this time on a Wednesday afternoon, and we've had one on sleep. We've had one on suicide, and we've had one then, the last one was Helen Minnis, the professor from Glasgow University, talking about stress at home and stress at work and attachment theory, and that was very well attended. Mm-hmm. Dawn's then going to talk more about the network conference at the end, but will I move on to the next slide and just talk about the affiliate studies?
Mm-hmm. Oh, does it seem to be moving forward? Hang on.
Is it not moving?
Nope. It's obviously, there we go, sorry.
Oh, that's brilliant, yeah. Thanks. So a really important aspect of Shine is that we offer schools that are part of the network the opportunity to take part in high quality research. You know, so many schools take part in research and then they don't get feedback on it, or you know, they don't really find, you know, they don't get to take part in good intervention studies. So that's been a really important thing for Shine, that we give schools this opportunity. And some of the research projects so far have been carried out directly by the Shine team along with other academic researchers, and other projects are completely external to Shine. However, all the projects that want to work in Shine schools have to complete an application form and a process that we've developed. The applications are reviewed by the Shine team and 2 of our advisory board before any of the work will be undertaken. Obviously, the research projects also have to get their own ethics and their own governance and everything too. But central to these Shine affiliated research projects is that the research must have a clear benefit to the participating Shine schools, and that they must feed back to the Shine schools. So whether that just be simple as a report or giving back the data, that's really central to being a Shine affiliated research project. So to date, Shine has been directly involved in 2 sleep projects. Last year we ran a sleep feasibility project in 4 Shine schools where we were measuring sleep with actographs, and you can see at the bottom of the slide there's actually on our website there's a briefing paper with the results of what we found in those 4 schools. That project was really important because it led on to part of the Shine team and other researchers winning an award to carry out the SCRAMS project, which is short for another shortened project name. That stands for Sleep, Circadian Rhythms and Mental Health in Schools. That project's underway at the moment. And we actually ran a really successful virtual sleep awareness week in 2 Shine schools in June. And we collaborated with Sleep Scotland, and we were able to use a lot of their resources in schools. But what was really important there was that the pupils co-produced, the pupils and teachers co-produced all the activities with the SCRAMS and Shine team. And again, if there's lots more on our website, lots more in the SCRAMS website if you'd like to look at that. And what we're planning now is we're going to be inviting a number of Shine schools to participate in some more sleep research feasibility studies in the autumn. And again, we keep giving this conference on the 24th of September a plug, but we're going to have a session just devoted to that so that schools can learn more about that sleep project. We were delighted through lockdown to participate with Generation Scotland at the University of Edinburgh on the Teen COVID Life project, which gave pupils a chance to really tell us how they were feeling through lockdown. I think, Dawn, you've got a little bit more on that on the next slide. And the only other project that's been approved and that we're going to be offering to the Shine schools, there's going to be a project coming up on social networks and peer influences on mental health. So that's coming out in the next academic year as well. But it's really just to give you a feel for this type of research projects that we are carrying out in Shine schools as well. Yeah.
Thank you. That's great. And hopefully this will now move forward. Oh, there it does. Great. So taking all of that development that we've done over the last 2 years, and particularly looking at the evaluation that we did of that very first report that we released based on the HPSC data, we're now, we've been working on a Shine online pupil mental health survey. So for those of you that are already members, you'll know that you've just had all the documents for the mental health survey placed in your Shine folder. So this is available as a resource for our members. It's completely free, as is membership for Shine. I should have probably said that at the beginning. But we've basically provided all our Shine schools with questionnaires for primary 6 and primary 7 pupils for primary schools, and then S1 up to S6 in secondary schools. And the questions are really looking at mental well-being, functioning, and how pupils are functioning and their mood. So there's a range of mental health measures in there. We have 2 versions of the survey for secondary schools, which are optional, so the school decides which one they would like to use if they decide to go, if they decide to use the survey. So one questionnaire has the life satisfaction questions and the well-being questions, strengths and difficulties questionnaire, and social and emotional health survey. But the other one has all of those questions and 2 questions on self-harm, which the schools can choose to use if they wish to. So again, this is placed in all the folders of all the members as a resource. They can use it at whichever time of the year they wish to use it. We would say don't use it any more than twice in one academic year, but it's really there as a resource with which schools can measure well-being in a particular year group or in the whole school, if they wish to. And that's really in response to the schools saying to us that they really liked the first report, but they wanted more data. They wanted to be able to survey more pupils. So the way that the mental health survey works is that a school would let me know that they have used the survey. They each have a login. They would deploy the survey, let me know that they've gathered all the data from S1 or S3 or all the year groups if they wish to do that, and I will then process the team will then process the data and return a report, which is very much along the lines of the model that's the example model that's on our website and the one that I was showing you earlier. So that's the kind of layout that we would use, with some context, with an explanation of the measures, and also with with a directory of where next, and some challenge questions just to help schools think about what the data's telling them as well. So we were all ready to go with that mental health survey back in March, and of course lockdown happened, and we took the decision that we wouldn't just send it out, even though it was online, because it's designed very much to be deployed in schools so that there's a teacher there deploying the survey and able to be with the pupils in the room, read a bit of a script to them about how to fill it in, help them, but also to follow up afterwards if there are any issues that it's raised. So it's very much for in-school use. However, as Judith said, the Teen COVID Life Survey, we worked with Generation Scotland on that, and we were able to use some of the questions from the mental health online survey and put them into the Teen COVID Life Survey. We then offered it to our secondary schools because it's a survey for 12 to 17-year-olds. And as Judith said, we always insist that the schools get something back. So the schools that did take part in that will have their own school level report, which should give them a report of how their pupils were feeling during lockdown. And there's a follow-up survey for that as well. So over 5,500 young people took part. 88% of them were from Shine schools. So the reports, the school level reports, will be going back to schools in mid-September, hopefully in a couple of weeks' time. And they will correlate with the mental health survey, which we're just releasing this week on the 4th, on Friday. So that will help to track and measure. So that was just a bit of a recap of the main points of the mental health survey. And probably worth saying, one of the things, obviously Scotland has a lot of rural schools and with quite small numbers. So one of the things that we wanted to make sure of was that there were ways for schools with small numbers to be able to still have a good representative data that they could use in their context. So for small primary schools, if they have other primary schools in their cluster that are SHINE schools, we can put their data together so that they can still have a school level report. So the numbers to receive a school level report would be, which is obviously has to protect anonymity for the individual pupils. So we don't report on individual pupils. It's very much trend data by gender and age group. So to receive a school level report where that wasn't compromised, you would need over 15 pupils. And within that 15, you would have to have at least 7 girls and 7 boys to not obviously identify anyone. So where there are very small schools that might not have that many in a year group, they could partner up with another cluster school, or you could actually put 10 cluster schools together if they're primary schools around a secondary school. So there are different ways to do that. And in a smaller secondary school, we can also collapse the data so that we can give you data for S1 to S3 and S4 to S6, so that you're sort of working within the 2 main sections of the school, so that you can see how the pupils are doing in those areas. And finally, so this is the last slide. So again, the researcher that's been instrumental in putting together the mental health survey that we're about to release, she will be presenting also at our conference on the 24th of September. Last year we had a conference when we got everyone together in a room, and everyone really enjoyed speaking to other like-minded teachers working on health and well-being, and there was lots of sharing of good practice and so on. So we thought long and hard about how we could do something for the network, even though we're all operating through screens. So we've put together an online conference that will be a series of webinars throughout the day. The invitations have gone out to our existing members just at the start of this week, but if schools do join in between times, then they will obviously receive an invitation to the conference as well. So we have some presentations on anxiety from Professor Kathy Richards, who's one of the lead clinicians at CAMS in Lothian. And as Judith mentioned, we have 2 members of the SCRAMS team, our affiliate project on sleep, and a little taster session from Sleep Scotland, showing some of their resources as well within that session. We've also got 5 SHINE schools who are going to talk about specifically how they used the data in their schools and share that practice with our members. And then we're delighted that we'll also have one of the researchers, Dr. Stephanie Chambers, who's written the overall report from our case studies of those 8 schools. She'll also be speaking about the findings from that. And then Professor David Porteous, who is the director of Generation Scotland, he'll be sharing the findings, what we've learnt from the Teen COVID Life survey. And also Dr. Colin Morrison, who ran the Children's Parliament survey for younger children, for 18 to 14-year-olds, which was running through the lockdown as well. So that was obviously for slightly younger children, but also finding out about the findings. So very much focused on using health and wellbeing data in the school context, looking at the findings and seeing what we've learnt from the recent data collections in the COVID era as well. And that brings me, I think, to the end of the slides. So we're happy to take some questions now. But if anyone is inspired to sign up to SHINE, Just at the top of the screen there, that's if you scroll down on the first page of our website, you'll come to this and it will take you through to the registration sheet. It's not a Google Doc, I'm afraid. It is just a download it, fill it in, scan it, send it back. I have to upgrade that at some point. But there's just an example of the form that you fill if you want to join Shine, which just requires a head teacher's signature and a contact at the school that would then be the Shine lead that would disseminate any information within the school and liaise with me. So as we said, membership is free and we don't impose any membership obligations. So we recognise that schools obviously have different capacity at various times. So we don't impose any obligations. And if you do want to get in touch or have a look at our website or follow us on Twitter, then I've put the details at the bottom. Okay, so there's a lot of information and so hopefully that was clear, but yeah, we'd be delighted to hear if you have any questions. I'll just stop sharing now so that we can go back to the main screen.
There's just one question in so far, Dawn.
Okay.
Yeah, it's just really asking, well, it's asking in the previous school I worked in, passed the pupil attitude to self in school survey to collect data and monitor all primary schools, and they are really just asking how Shine is different to the data collection by the PASS survey. So I suppose the answer there is we're free.
Yeah, there's also that, but the PASS survey focuses very much on individual pupils and attitude to school. So so there's a lot of schools in the Shine network that use both. So obviously my background is very much guidance teacher and pastoral deputy. So with our data, with the trend data, you're looking very much at the context that your pupils are existing in. You're able to see those trends year on year, whether confidence levels are going up or down. But obviously there's always the sort of year group structure versus the individual that you're having those sort of one-to-one guidance chats with. So you're using the data in different ways. So we always used to talk about the sort of, you know, those horizontal year group structures versus the one-to-one. So
do you want me to read out the questions, Dawn? And then, so there's one.
Is that okay? Yeah.
Okay. One from Lindsay. She said, I work in a small special needs school. Would it be linked with other special schools or local schools?
So at the moment we have 3 special schools in the network, and we obviously we've issued the resources to those schools as well, but really we'd be very interested to work with special schools and it's very much a two-way process. We would like to hear from schools if there are things that we can develop. I mean, certainly when we did the Teen COVID Life survey, the first thing that people asked is there a version for ASN pupils? So we went back and completely rewrote the information sheet, and I sent out information to schools about how to either record the information or where to tell pupils to sort of get it to read it aloud. So we're really open to learning more about how we can support with health and wellbeing data use in special schools as well. So yes, do join us.
Yeah. So Dawn, I don't think there was any special needs schools in the HBSC data. So if a special needs school joined, they would get a RIC report, but then moving forward with the mental health survey, they would get their own individual data back for that. And as you say, we could maybe work with other special needs schools to do comparisons or something like that. Yeah.
And certainly one of the things within the network, because I had someone ask me whether I could put them in touch with other schools in a similar situation because they were on an island, and so I put them in touch with other island schools and they formed their own little island network within the Shine network. So yes, absolutely, I'd be happy to make introductions.
So there's a question from Louise just on the chat just saying, hi, wondering if someone can tell me which schools in Fife are using Shine.
Yeah, I would be happy to support that with Louise.
Yeah, and also, can you clarify if Shine is free? I think we've said that.
Yes.
We're funded by the Medical Research Council, so that's where we get that funding from, and then we have to go back to them with all our outputs and what we're doing with the money. So I was under the impression that it was paid for by PEF or other funding by the school or LA. Yeah, hopefully that's clarified that. So that's where our funding comes from, and we had initial funding from the Medical Research Council, and we've actually got 2 years more funding from yeah.
It's probably worth saying, actually, we're based on a Welsh model that's been going for 8 years now. So that's fully integrated with the inspection team, with the government, and they set up a schools research network, so 8 years ago. All the secondary schools in Wales are members of that, and they routinely collect data, and so we've very much learnt from them. They're our colleagues down in Cardiff University, and our director and one of our team leads was instrumental in starting Churn down there, so we're very much linked.
Yeah, and because they're that little bit further on than us, any teachers that were at our conference last year, three of their teachers came up and give great case studies of what they have been doing down there and what they've achieved. Yeah.
Yeah.
I don't. Am I? Yeah, just some people saying that they'll discuss it with colleagues and then come back to us. Yeah.
I think it's worth noting, well Dawn and Judith, that if any schools were interested in looking at a certain aspect of health and wellbeing, you're able to kind of put them in touch with other schools if they would like to do that as well as part of the network.
Yeah, and it's also worth noting that we work, as I said, within the Institute of Health and Wellbeing, so we have access to a huge range of health researchers working on various different aspects. So again, if schools are interested in particular areas, then it might be that we can put them in touch with people that could help, or that we're aware of organisations who are working on those things. Our next webinar, actually, that will be in October, will be from the School of Education and University of Glasgow, with a team working very much on inclusion and additional support needs, and looking at the well-being of, supporting the well-being of pupils within schools with additional support needs, and supporting inclusion. Yeah.
Hey. Thank you so much, Judith and Dawn. And I'm not seeing any more questions there, and just aware that people have been working a long time today. We're getting towards the end of the week. So a huge thank you to both of you. And hopefully for everybody who's joined us today, you'll be able to see the value of this resource, which is free, and not only provides us with excellent data on areas that perhaps in a school we need to improve on, but like you said earlier, Dawn, as well, also areas that we're doing well in. And I think it's important to hold on to that as well, and not just focus on what we need to be mending, but look at what we're doing well and understanding why that's going well and keeping that going as well. And we can't underestimate the importance of emotional well-being. We have school improvement plans. Quite often we have curricular areas on there, particularly literacy and numeracy. But if the emotional well-being of our young people is not strong and not in a good place, then the foundations aren't there for any other learning to take place, for lifelong learning to take place. So, it really is hugely important. And I would imagine everybody shares that view, otherwise they wouldn't have joined us today. Just to say thank you very much to everybody for joining us tonight, and to have a good evening.
Thank you very much for having us.
Thank you.